Hi, good morning Fernando. My name is Mihiraa. I'm your invigilator for the OIT speaking session on the 2nd of February 2022. How are you doing?
Hi, good morning, Mihiraa. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Fernando Lorenz.
And what is your candidate number, please?
My candidate number is 213175593.
Thank you. And you are taking this test as a nurse. Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed, and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right, Mihiraa.
Describe your typical working day.
My day starts with a prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients in order to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterwards, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I definitely find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by evening 3:30 after giving handover to the next scheduled staff members.
What are the pieces of advice for the upcoming nurses?
As a nurse, definitely, I can give a bunch of advice to upcoming nurses. Firstly, I advise them to love their profession. If anyone loves their profession, they can carry out their responsibilities in an efficient manner without complaints. Apart from that, I advise them to be dedicated to their profession and maintain professional standards. These are very essential because a nurse should abide by nursing ethics on any grounds. These are a few pieces of advice that I like to give to future nurses.
Do you think nurses should attend continuous nursing education?
Yes, I do. The continuous nursing education program helps nurses to update themselves with the current practices in their profession. Moreover, nowadays, it is mandatory to have specific hours of continuing nursing education in order to renew the nursing registration. Hence, continuous nursing education is very important for nurses.
Tell me what you feel your greatest skill as a nurse is.
My greatest skill as a nurse is my communication ability. I'm very proud of my ability to really listen to what a patient is telling me. Nothing frustrates them more than feeling as though they're not being heard, and actively listening can go in helping make someone comfortable. In addition, I learned that addressing their concerns and communicating in an assured manner make them feel comfortable, which is important to receiving quality care.
How do you handle the stress of the job?
I find the best way to handle the stress of being a nurse is through meticulous organization and attention to detail by making lists and prioritizing what needs to get done throughout my day. I find that tasks which might seem overwhelming all at once are much more manageable. This also makes it possible for me to stay calm and remain focused on what needs to get done when unexpected situations arise.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, Mihiraa.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there is anything you need clarification, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you, Mihiraa.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your OIT speaking role play. Don't worry if I stop you when the time is up.
Good morning. My name is Fernando Lorenz, one of the nurses working in this department. Kindly confirm your name for the documentation.
Yes, my name is Mihiraa.
Mihiraa, I can see you have an appointment today. Can you please confirm why you made the appointment?
I have an appointment to get information about my mother, Patricia Portsmouth's post-discharge care. She recently underwent cholecystectomy and is now being discharged.
Thank you for your information, Mihiraa. Before we start, please let me know about the arrangements you have made for your mother's living post-discharge.
Well, nurse, arrangements have been made at home itself. We have disinfected the home, and her room also has got some modifications to suit her needs.
That is an absolutely great decision. Always, being at home is very special. At the same time, it's good to hear that necessary home modifications have been done for her needs. Now, let me take this opportunity to describe the benefits of our patient living with family. It provides practical or emotional support to her in this particular situation. It also helps in maintaining social interaction, which will make her stay positive. By the way, I would like to know, what is your view of your mother's recovery so far?
I am very much satisfied and happy to see her progress. The hospital so far has treated my mother flawlessly. That's why she attained good health after the surgery. I can see that she is energetic and in a good mood. But nurse, I wonder why she is not getting discharged.
Mihiraa, first of all, it's pleasing to hear that you are satisfied with her progress and the care we are providing. Your concern regarding discharge is natural. In fact, I will explain the necessity of extended stays for your mother. One of the main reasons for prolonged hospitalization is her age. In order to avoid complications due to age, her discharge has been extended. Even though she attained good health, her recovery was slower than expected.
Oh, I see.
For your understanding, I will briefly explain your mother's progress. So far, there is no infection caused after the surgery. Her improvement in appetite is a very good sign. But still, she has minor discomfort, which will be settled gradually.
All right. Thank you for your briefing, nurse.
It's my pleasure, Mihiraa. Moving forward, let's discuss your mother's wound care post-discharge. It is very essential to clean the wound daily, which will be demonstrated to you before the discharge. Always remember to keep the wound site covered. These measures will help to enhance her wound healing and avoid infection.
That's okay. I will take care of it.
Mihiraa, your mother has been provided with soluble stitches, which will disappear in 2 to 3 weeks' time.
That's good, so she can avoid a hospital visit.
Yes, that is right, Mihiraa. Now, she has been prescribed some medications for her post-operative days. I will outline those medication details for you.
Okay, you may please.
First of all, she needs to continue her oral antibiotics for 5 more days. Next, her pain relief medication needs to be given only as per her need. She has also been prescribed laxatives twice daily unless her stool is loose.
Okay, I understand that. I will follow your instructions.
I appreciate your willingness, Mihiraa. I would like to bring your attention to some restrictions which your mother has to strictly follow.
All right. May I know the restrictions, please?
Sure, we can go through the restrictions she has. She needs to refrain from lifting heavy objects, as it can lead to complications. She can perform only gentle exercises for the next several days. Well, talking about her diet, it is important to consume a small quantity of food each time, but the intake should be frequent to ensure her nutritional status.
All right, I will take care of it, nurse. And I think there are a lot of things that she has to take care of for a better recovery.
Yes, Mihiraa. You are absolutely right. But try not to be worried. These are small things, but are essential as well. I know, it will be hard for anyone to remember this until one gets used to it. Don't be concerned, we will be providing details about the post-discharge information in the discharge pack. Apart from that, you can avail further support from the medical team post-discharge as well. I will outline such aids available for your mother's care. The community health center nearby will give her all the essential care needed for her recovery. You can contact the community nurses for that. Along with that, your mother's doctor will also be there for her assistance.
All right, now I feel a bit more confident.
That's wonderful. Now, Mihiraa, do I need to address any further concerns for you?
No, nurse. I feel I am well informed. Thank you.
I am glad to hear that, Mihiraa. Always, feel free to contact us for further queries. I wish your mother a speedy recovery.
Thank you, nurse. That is the end of your OIT speaking roleplay. All the best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.